Welcome back, guys. We're a little change of scenery. Used to seeing Taryn's house. Now you're here at the Wade's house. So we're going to be covering a podcast, going over Robin, who is currently pregnant and about 3 days away from her due date. So we're going to be covering what you should be doing, building up if you're planning on getting pregnant, if you're pregnant, how training should be, lifestyle. We're talking about nutrition, trying to cover everything under maybe some cultural misconceptions, something like that, and just kind of help guide you along through it and her experience, her first child, and going from there. And hopefully in the future, we'll come back and go over some postpartum as well.
Absolutely.
This is Robin, by the way. She's a CrossFit Level 2 certified trainer. She's also a doctor of physical therapy. So I'm lucky to have her in the gym, and more importantly, as my wife. Robin, you want to say anything? Where do you work?
So I work actually in the pelvic health space, inertia, physio, and pelvic health up in Abingdon, Virginia. I try to coach when I can. It's been a little while since I coached at the gym, but it's something that I really definitely enjoy. And again, just fortunate, feeling really lucky to be pregnant, to be so close to delivery, and we're looking forward to welcoming our first son. So
John Michael's on the way. Before we get into that, a few announcements, just like we do on all the other podcasts. First thing is we have dogs around us, so if you hear any barking or somebody comes to the door, you're going to hear that. So sorry about that. Even cats may be up here. Next thing, we had our Halloween party last night. Great show, and we'll pop up some pictures here right now. And then also we are doing a nutritional holiday survival guide coming up on November 9th. And you can hear the dogs in the background. So on November 9th, we'll have that. So plan on coming in. We're going to kind of give you a blueprint. Taryn's been working really hard on it to get that together. So we'll get that set up, and maybe one day we will return back to his house to record a podcast. So just kind of giving a background of everything, like where Robin's coming from. We need to know like where she started as far as health and fitness and where she's at right now. So could you give us a little background of maybe sports growing up or something like that, and kind of build up till today where you're at now?
Yeah, absolutely. So sports growing up, I would say I was definitely not in your usual sporting settings. I did a little bit of archery. I ended up in rowing, but I always kind of had this bit of an athletic drive and interest in performance. In middle school, I would bike every day, just out on the roads around our house. And I remember I would time myself on our microwave timer.
She's always been competitive.
Always been competitive, even against myself. So always had an interest there. Wasn't always the most academically inclined, kind of struggled there a little bit. And so I always thought that I would take like a more creative pursuit, kind of pursue something artistic. So my undergraduate is actually in industrial design, designing anything that's mass produced, essentially packaging products, anything like that. And I knew that I would want to go into graduate school, kind of pursue further education if I wanted to find something that felt a little bit more meaningful to me. I wasn't really finding it in that design field, but I wasn't really ready right out of graduation to do so. So I've worked a lot of different jobs. I've served tables, winterized boats for a season, kind of just a little smattering of everything. And during that time, in my spare time, I would read health books, diet books, like training books, just really delved into that. I did a lot of endurance running on my own. Not a lot of strength training, but a lot of...
I would say a lot of, from what you've told me, a lot of stuff that kind of looked like Murph prep type training. Like a lot of bodyweight stuff for military.
Yeah, like tons of like online get skinny programs, like step ups on chairs at home and that kind of a thing, air squats, EMOMs, a little bit of triathlons, dabbled in that. And then finally joined a CrossFit gym in 2016. Buddy of yours up in Johnson City.
Yeah, Chris Rasnick and Brad Weems. They had Thunder Valley Fitness now. It used to be
CrossFit.
Yeah, it used to be a CrossFit gym. They deaffiliated, but Yeah, that's how we kind of met. I saw somehow Rob and I were friends on Facebook, so I'll just go ahead and tell our relationship story too. We're somehow friends on Facebook, and like I just seen her pictures, and basically they were really good pictures, and I put like a little love thing on there, and we started messaging from there. So
Yeah, so
if you see her
that's how
face
we
get
met.
red, you know why. But that's that.
Yeah.
So she went to Thunder Valley. Sorry to cut you off.
Yeah, no, actually, I was going to bring that up. So, yeah, that's how we met, kind of backing up to all the, like you said, Murph prep type stuff I was doing. I was like always injured. I had shin splints, some like wrist issues, tennis elbow. It was always something. And like a lot of your PTs will say that they got into PT because they had like a really incredible rehab experience. The only time that I went to PT as like for myself was when I ran into a closet door when I was like 10 years old and my neck got stuck sideways.
Sounds like Robin.
Sounds like me. So joined CrossFit, actually had the least injuries out of any of my athletic time that I've been active, and actually started eating more. And that also contributed because I was chronically underfueled. So I came up to your gym, I'd say late 2017, early 2018, and kind of got even further into CrossFit. Later that year, got my L1. Didn't know what I wanted to do with it, but I knew that I had this interest and I wanted to go further into that space. So you've been through that L1, L2, L3, all just excellent. I really.
Yeah, we highly encourage, if you want to learn anything about CrossFit and why we do it, in an hour we can only explain so much of why and what we're doing, but if you want to really, really dive in, go to an L1 or L2 and you're going to get bukus of information if you want to do this type of thing, or just if you got the money and you want to learn, it's a great opportunity to learn. They also offer an online one as well.
Oh,
I think,
okay.
Galen actually during COVID had to do his level 2 online.
Interesting.
So it's really, he said it's really good. You still had to like get up in the position and they walk you through. So it's really neat.
Yeah. Yeah. So definitely recommend. I started actually shadowing some PT later that year as well. Got an actual idea of what they did because I didn't really know. I mean, as I said, I was always injured. I didn't really know what PTs did. And so I kind of decided, well, either I'm going back to school or I'm not. And we talked it over with you, with the family, decided now or never. And 2019, 2020, went back to school, and definitely like best decision I made. So
yeah, and she was at South College, which is an accelerated PT school, and it is work. It is a lot of work. Like we're cramming. They were trying to get in. Like I would get a few calls a week because she would stay in Knoxville and she'd be stressed out and overwhelmed. But she did extremely well. Bragging on you. Worked hard. Kudos to you.
Great program. It was really great.
Did Zach recommend that to you?
Yes.
Zach,
yeah. So Zach down in Morristown, great PT. One of those that got me to, that's the dog, got me to where I was able to see like, this is what PT can be. This is what PTs do or should do. And so that really helped lead me into the field as well, for sure.
So pretty athletic background. Like I would say most of your athletic ability or athletic career was spent rowing. You and your brother.
Yeah.
Pretty good rowers. Long legs, very, very strong. Backsides, posterior chain is incredibly strong. Robin's a 350 deadlifter.
Not great at bench, better at rows. Anything pulling.
Yeah, very good pullers. Like Taryn's wife, Lauren, very good puller. So she came from that background and then transitioned and pretty much good at everything. Like kind of like a good CrossFitter, a generalist. She's very good at everything. And then, so that being said, going into the pregnancy stuff, we found out in February that she was pregnant. So I came home from driving to Jacksonville, Florida in one day, next day picking up a camper and driving straight back from Jacksonville, Florida that evening, getting home really, really late. And I come home and she has all this stuff laid out in the bed and she said, we're having a baby. So we figured that out. And then once we figured that out, her training shifted a little bit at first, maybe not a lot. And then let's kind of walk them through, like, maybe best to break it down into trimesters. Like, all right, first trimester, I trained this way, ate this way, and then second trimester and so forth. So we're trying to bring it down, like I always talk about our 4 pillars. So nutrition, exercise, or movement, we should say, recovery, and community. So we'll talk about the first 3 the most.
Yeah.
So
I would even say, like, pre-pregnancy, I wasn't necessarily like where I would have ideally wanted to be fitness-wise. I was working a different place, about double the commute time shift that sort of flip-flopped back and forth. So I was making it like 2-3 days a week. And in that first trimester, you're really just dealing with like all the nausea, the bloating, just feeling generally nasty. And so I think it's easy to step away and be like, I just can't do anything. I feel exhausted and I just like can't do anything. And so I found just like giving the effort that I had and doing the things that I felt like I could do, there's no real like the baby at that point is still within the pelvis, like the pelvic bony structure. So it's not like you're going to do anything that's really going to impact like the baby.
yeah.
But mainly I will say like the limitations are just feeling awful, like just not feeling well.
Yeah.
And so to the extent that that takes you away from the gym or out of the gym, not letting that continue to be the case once you get to feeling better.
Yeah.
So that's kind of one of the biggest things that I think that I see is that you get out of the routine of things, get out of the gym, feeling rough, maybe just don't go at all, and then don't go back.
Yeah.
And so that's, I would say, like, not what I would recommend, not the
For
best thing
sure.
that you
And
do.
like CrossFit or Teen Experience, what we're known for is moving large loads, long distances quickly. So we're lifting heavy, we're sprinting, we're doing high intensity interval training, we're doing any and everything in between. It's one of those things, as you've heard the 4 horsemen, I'll call us, Galen, Steve, Taryn, and I talk about how hard should you train when you feel like that? Well, it depends. Like, it's always dependent on how hard you want to go, how your body feels, and day to day it might fluctuate. We've had a ton of growth of babies in the gym here lately. People pregnant. Kennedy is one of those where first, she's telling me the other day, first 18 to 19 weeks is basically she was horribly sick, and it was minimal training, and she's getting back into it right now. So 18, 19 weeks for Kennedy. Everybody's a little bit different, but we encourage you to come in and do something. Like, you need to be moving. It's good for you. It's good for the baby. Like Robin said, the biggest disservice you can do to yourself and the baby or Rosa is to quit moving. Is absolutely quit moving. Maybe talk about your nausea and how you fix that, and like your diet protocols.
Yeah, so diet is an interesting one. Again, something that we definitely want to optimize going into pregnancy. And actually, I think like going into pregnancy, we both were in a pretty good place because we were coming off the Outlier challenge.
Yeah.
So I guess probably
Yeah,
not planning that
maybe like
yet,
2
but
weeks
something
out.
we'll do.
Yeah, maybe 2-3 weeks
Yeah.
out of the Outlier.
Something I'm sure you'll be doing again this year,
Yep.
January. And so nutrition was like fairly dialed in. But the pregnancy nausea was not what I expected. Of course, everybody tells you, you could be nauseous, could be feeling really terrible. But what I didn't expect is that if I ate, the nausea would get better. So I was snacking all the time.
Yeah.
Like macro wise, I would hate to know what my caloric and carbohydrate intake looked like, because it was lots of plain foods, lots of snacky foods, just like anything that I could keep down, and just like kind of a constant intake.
Yeah.
So that first trimester, it's kind of just, it is what it is. But to the extent that you can optimize nutrition, what I would recommend is kind of your basic FIST protocol. So what a FIST of
Yeah, fist-sized serving of protein, fist-sized serving like healthy carbohydrates, like a fruit, a starch, rice, oatmeal, something like that. Maybe double that if you're really active. And then a fist-sized serving of some sort of healthy greens, and then a thumb-sized serving of fat. If you can do that, you're going to stay pretty well in the lines of calories and probably feeling pretty well, unless you're like Robin and have that nausea going on. But when we were in Yosemite, when we were in Yosemite, when we took our little baby picture, she was having a hard time because we were middle of nowhere and trying to keep her with something fueled in her. And she had a kind of a rough time, especially with some of these longer hikes we were going on.
Yeah, yeah. So like going into pregnancy, FIST protocol, to the extent that you can maintain that through that first trimester, that's excellent. Because, I mean, like these little baby apps, they'll tell you week by week, like this week eat kale and this week eat sweet potatoes because of certain vitamins. But just like any other time, the more colors, the more different vegetables, the more different nutrient dense foods that you can be getting, the better. So like, I wouldn't say like week 13, eat Swiss chard, like just switch it up.
Yeah. Just if you're not pregnant, you should still have all these foods.
Yes.
Like,
Exactly.
And there's you don't need to reinvent the wheel. We know that they're healthy for you and they're healthy for the baby.
Yeah. And so that's, I guess, like macro wise, throughout pregnancy, I wouldn't get too like edgy and creative and try new things. This isn't the time when I would necessarily go keto. This isn't a time when I would necessarily go low fat.
Yep.
The fat is going to be very important to cell structure, to the baby's nervous system, myelination. You definitely don't want to cut that out. And then again, to the carbohydrate perspective, if we're getting most of those or all of those from our vegetable sources, you're getting your key nutrients there. So this is one where, again, like that FIST protocol, you're going to be getting what you need. I would stick with that as far as like a basic macronutrient breakdown. In your podcast, I think it was your last podcast that you were going over Stacy Sims on Andrew Huberman.
Yes.
So you mentioned her kind of baseline caloric intake for just general women to not tip into endocrine dysfunction. It was 30 calories per kilogram of lean body mass. And so for me, that would be like 1,800 to 1,900. So through that first trimester, I'm keeping about 1,800 to 1,900. Your basal metabolic rate, so that baseline, like this is what I'm burning, doing absolutely nothing, rate is going to go up by about 10% in that trimester. I think about 5% in that trimester. Sorry, had to refer to my notes.
Not like a huge difference.
No, that's why they say like first trimester, you don't technically really even need to increase at all. Like you can kind of just keep it baseline. Second trimester, there's a lot of growth of the baby. There's a 10% increase from your baseline. And then third trimester, we have a 25% increase from the baseline. So for me, if you just like Google how many extra calories do I need, the Google returns like 0 first trimester, 340 in the second, and 450 in the third. And so if you look at that basic 18 to 1900 calories, add on those percentages in calories, that's about what it comes out to.
Yeah. And so that's a good baseline if you are not as active, but Robin stayed active throughout this whole thing. So changes, sorry for the pizza. You know who it is if you're from Bristol. So that kind of wraps it up with diet. Listen to your body. Like there were some times where Robin couldn't eat eggs and like she had to get her protein from another source, and that's absolutely fine. If you need to supplement if you know your body that well, but just make sure you're getting the right breakdown of protein, carbs, and fats to keep you happy, healthy, in other words.
Absolutely. And if you need any help with that, personalized nutrition is definitely something that we can help with. Macronutrient wise, just helping you meet those goals that you need to meet in order to maintain a good health during and throughout pregnancy.
You will feel better because you're carrying a big load, literally. Like you'll feel better if you are fueled properly, if you're getting enough sleep, and if you're still exercising.
Fewer injuries, less pain.
For sure.
Yeah, definitely.
So we covered nutrition.
I do have one more thing on nutrition.
We have not covered all of it. Yeah, hydration.
Yeah.
Very good.
So our bodies are going to be just going through a lot of processes. There's a lot of constipation that can happen during pregnancy with the decreased motility, as well as cramps, just like the most random cramps, muscle cramps. Like I had my calf, I had my tibialis anterior, like the front of your shin, just really random. So getting electrolytes I've found can be extremely helpful. So Element, something to that extent.
Yeah, and if you've seen recently on the internet, Element is kind of called a bad rap because they put maltodextrin in there to kind of flavor a little bit. It's included in their natural flavors, which is, don't know why they just didn't put it because it's not a big deal. I think each pack has a half, well, actually it has 10, my bad. But it's nothing, all right? It's basically nothing. There's a lot of uproar from the keto and carnivore community, and you're not going to, in my opinion, from all the research I've seen and all the stuff that I've done, you're not going to get an insulin spike from that few amount of calories.
I think I was looking at a recent study. I think it was looking at xylitol, but the study that found like some sort of effects, the amount that these people were eating was like a baker's bag a day. Like it's a ridiculous amount that nobody would realistically ever do.
Maltodextrin is actually a sugar-ish. It has calories, but it's a little bit sweeter. That way can flavor it so it doesn't taste like garbage. They also have raw salt, but I don't think anybody would want to drink just a cup of salt. So, all right, we'll get off that soapbox, but Element's good. If you want to do liquid IV, do liquid IV. We just have Element.
Yep.
All right, guys, so that's basically nutrition. We've covered that throughout, like how much calories you should eat. Like I said, if you need help with that, just reach out to us. The reason why we want to cover that first is because nutrition is the base of the pyramid. So that's the most important thing. You can't out-train a bad diet. If you're putting sugar in your gas tank, in your sports car, you're going to have problems with it. So I want to cover that first. We can talk about basically what the body's going through right now and then training and how to prepare for that and do that. So Robin's going to talk.
So as far as changes, you may see me referencing my notes, but I've got them kind of broken down into general sections. So the first that we'll look at is hormonally, what is going on. That's, of course, like basically the biggest driver of what's happening in your body. So the big three that I would focus on are relaxin, estrogen, and progesterone. And so relaxin, just like it sounds, is relaxing the body's ligaments. It's loosening the ligaments, which are what connects bone to bone. So they are joint support. So looking at specific areas of the body, we're going to see the rib cage become like more lax and expanded. We're going to see the pelvis also widen. And then you also can see changes in feet and wrists. Those are common areas. So you'll hear women say, oh, I went up a shoe size. That's because the ligaments in your feet have relaxed. Those arches may have collapsed a little bit. And so your foot is artificially larger. In your wrists, we can have, of course, like global swelling a little bit. And then if we have laxity and in this area that just naturally doesn't have a ton of muscular support, you can experience carpal tunnel symptoms. So in these areas, having more muscular support is going to be advantageous to keeping those things at a minimum. One more thing with the rib cage, where it does expand, that's the muscular attachment for our diaphragm. So the diaphragm will actually sit a little bit higher and can feel kind of short of breath. So training wise, that may be something that you notice.
Yeah, hold on one second. We're going to yell at the dogs. And we're back. So yeah, your body's going through change. Everything's getting a little bit more lax. And
As far as estrogen and progesterone, of course, just big changes going on there, but from a training perspective, estrogen is going to help. It's actually going to help protein synthesis, muscular and bone health, and then it also can contribute to some extra laxity. And then progesterone, just a little kind of interesting tidbit, is that it kind of across its roles is to help us keep the baby in the uterus. So it strengthens the pelvic walls, but it also can keep our body from attacking the baby as a foreign object. And in doing so, in women who have like pre-existing autoimmune issues, oftentimes they'll notice that they have much fewer autoimmune issues during pregnancy because of that progesterone.
Interesting.
So just nothing really that pertains to specific training, but a very interesting.
And I'm learning here with you because this is great. This is great for me. Yeah, so that's really neat. Is there anything that you could relate that to for someone who's not pregnant to help maybe make those hormones optimized? Maybe not the relaxin since your body's not pregnant and needing that so much?
I don't know, but as I was going through this, I was curious just about hormone replacement in autoimmune people, like people with autoimmune issues, because I've never heard of that as a strategy. And of course, we do have lots of effective hormone replacement for women going through menopause and with bad like perimenopause symptoms, things like that. But I've never heard of it being used for autoimmune. So I haven't looked into the research, but I was curious about it.
Okay, that makes sense. And there's also, do you think diet would help as far as like that's what I was kind of getting at, the autoimmune protocol? Like if you have some symptoms like that, if you're chronically sinusy or whatever, how an autoimmune protocol type diet would help you out?
Yeah. So that I mean is always going to be kind of my first go-to. I had a patient who had some nervy symptoms. She was still going through them, but she had a daughter with autoimmune issues. And so they together switched to an autoimmune protocol. I'm not even going to try to explain that because it's, I mean, you cut out nightshades, you cut out legumes, eggs, nuts, a lot of these things, but there's also certain spices. So it's probably best just to look it up. Yeah. But she and her daughter went on this autoimmune protocol, and she said that every day of her life she had been having like cough drops. Like she just kept them around because her throat was always scratchy, and she just thought that was like the state of being that she existed in. And when she started that protocol, it cleared up. She didn't need them anymore. So as I said, still had some issues going on, but cleared up a lot of things with that.
If you have any problems like that, highly recommend it. Like I've done it. It makes you feel way better. I'm chronically sinus. Autoimmune just means if you're eating certain foods, your body reacts your immune system to that food, which causes inflammation, pain, whatever. People have rheumatoid arthritis. It's really good if you can get on something like that, which will eliminate those flare-ups, make you feel a little bit better. You'll sleep better and live a more healthy, fulfilled life.
I always have a bit of a soapbox on arthritis in general. Rheumatoid is the type that runs in your family. It's an autoimmune issue. Osteoarthritis is your generic joint arthritis. Number one predictor of that is like if you had a pre-existing injury in that site. However, kind of this long-standing misconception is that things like running or lifting heavy are going to cause more arthritis, and those just don't stand up. That is not the case. Arthritis is an inflammatory issue, whether it is rheumatoid or osteoarthritis. It is an inflammation of that joint with degenerative changes. And so things that cause inflammation are what are going to drive that. So if Debbie's eating lots of Little Debbie cakes,
don't eat yourself, Debbie.
and not getting up off of her couch, she's probably definitely putting herself at more risk for osteoarthritis than Justin hopping on the bike and eating an autoimmune paleo protocol. So that's just my little sidebar soapbox. just because I'm very passionate about the misconceptions about arthritis in general.
Yes, so. Very good, very good.
Other changes to the body, if you want to continue on that, is that
good,
we
can do that.
Good path to follow? Mm-hmm. So physiologically, the increase in blood volume is going to drive like, I won't say most, but like a lot of the symptoms that we have are going to be driven by an increase in blood volume. So we have this large increase in a hormone called aldosterone. I'm going to call it a hormone. May not be. It's a thing in the body called aldosterone, and it helps our kidney retain more sodium. And so by doing so, we retain more fluid, and our blood plasma increases. Something to know is that our blood plasma increases more so than the red blood cell count. That also does increase, but just not to the same extent. So you can have a physiological anemia that can cause extreme fatigue. So in the case that somebody is experiencing this extreme level of fatigue throughout pregnancy, that may be something to look into. And if you're wondering from a dietary perspective, could you mediate that? Another thing I haven't looked into, but I wouldn't see why having a higher iron reserve wouldn't help.
Yeah.
Going into pregnancy not anemic is certainly going to be better than going into pregnancy with anemia.
For sure.
So, with the increase in blood volume, the heart is going to have to work harder to pump more blood. So we actually have an increase in the size and thickness of the walls of our left ventricle that's pumping blood to our whole body. We have dilation of some of the major vessels throughout the body. And then our oxygen consumption is going to increase by around 15%. So we're going to see a 10 to 20 beat per minute increase in resting heart rate. You're going to see an increase in respiratory rate. And so you're going to see women who get out of breath more easily. We already talked about mechanically, the diaphragm is in a little bit different position, so getting out of breath more easily.
So if you catch yourself walking upstairs breathing harder, it's kind of normal.
Like, it is normal.
You don't want to be so out of shape that's like a normal before you're pregnant.
Yeah, and we'll actually get into that a little bit with the training guidelines, because it is really easy to spike your heart rate, to feel like you're just breathing really hard, like your heart rate is going really high, because it is higher than it ordinarily would be. And it's sneak peek, not a bad thing to get it up into those upper ranges and do high intensity training. But all of that does mean that you're going to be burning more calories. Your basal metabolic rate is going to be going up. And so you should be increasing your dietary intake, nutritional intake to compensate for that.
Absolutely. Absolutely. So covered what's going on in the body, covered the nutrition. Now we're going to talk about the fun stuff, the training. What's that look like? Like we said previously, Robin was coming into the gym. She's doing classes anywhere from 3 to 5 or 6 days a week. Were you sauna or cold plunging at the time?
Yes.
Yeah, she was sauna, cold plunging as well. And then February, we find out she's pregnant, and let's just kind of start from there, how training progressed through. And there.
So in the first trimester, as I said, I was kind of like just getting to the gym when I could and doing what I could. Again, there's not a lot of anatomical changes at that point from a training perspective. But I did feel like kipping even early on, kind of this like exaggerated body opening just did not feel good. And that actually can also be related to that increase in aldosterone, increase in water retention, because that increase in water retention can mean that our fascia actually tightens. So that kind of fibrous layer that goes around our muscles can tighten a bit. And so it just wasn't comfortable to me. Many people do not have that same experience, but even though I know people get tired of hearing "listen to your body," like listen to your body. If something hurts, modify. If
she's doing kipping pull-ups and it hurts, it doesn't mean that she should stop all upper body pulling.
Correct.
You can do rows, you can do ring rows, you can do banded rows, you can do whatever you want.
And that's what I've found in the research throughout pregnancy is like, this is common sense stuff. I mean, the things that are dangerous, you're gonna have lots of warning signs. Like your body is gonna tell you not to do those things. In the second trimester, we're seeing the baby grow a lot. And so a lot of women during that trimester specifically will choose to stop doing Olympic lifting and may choose instead to do kettlebell swings or dumbbell versions of those movements. Not because, again, they're dangerous, but because many of us have worked very hard to get that bar path nice and close to the body. And so oftentimes it's this trade-off of like, it's just not worth it to lose my form that I've worked so hard to achieve. So
or hit your belly. Like worst case scenario, you hit your stomach pretty hard. Or you, like you said, you start losing technique and you're doing clean, but in that clean you end up doing a reverse curl and getting away from you, hurting yourself while you're pregnant, which is not good as well.
Exactly. Yeah. So again, not something that I would say like, oh, you have to quit doing this because it's dangerous, but something that you may choose to adapt or change just based on your own personal comfort level. And then third trimester, that's when we're really seeing these huge anatomic changes. You're oftentimes going to see a little bit of that rib flare. So those ribs kind of opening forward. The pelvis is going to tilt forward so that we've got this big stretch on the anterior structures of the abdomen. And so this is kind of a hot topic as well. Looking at diastasis or diastasis, you can pronounce it either way. And what that is the six-pack muscle that goes over the outermost layer of the abdominals is called the rectus abdominis. It's got a fascial line down the center. You can see that on people who have very defined abdominals. And that's called the linea alba. And so in order to make space for that baby, as my ribs flare, as my pelvis comes back, you're going to have a stretching of that linea alba, both this way and like transverse wise. And so a lot of people envision this as a separation. And you can have what is called coning or doming, where you essentially see a bulge that can come kind of looks like it's coming through your belly.
Like a shark fin.
Yeah, like a shark fin. And that is when those deeper abdominal layers aren't necessarily bracing as efficiently as they could. So we have 4 layers of abdominal muscles. Those deep ones can kind of create a nice stabilized barrier. And so if they're not engaging really well, sometimes you can see this kind of doming or coning. And so I've seen women who, again, will completely get out of activity because they're like, oh, I don't like that. It's gross. I don't know what's happening. I'm afraid that I'm going to break something, and I don't want to do it. That is not a contraindication to fitness. So meaning if you are coning, if you are doming, again, if it is extreme, if you have belly button pain, and if you are losing if you are losing your form, so if like that form is just completely falling apart, let's say on like a kipping pull-up, it's a reason to modify. And so if there is a slight coning or doming, not a concern. If it's like non-painful, again, not a concern. But like I was doing some kind of supinated-ish ring rows a week or 2 ago, and I was having some belly button pain. They weren't feeling good. We did bent over rows. And I felt like I was able to maintain my midline a little bit better that way. It's a good reason to modify. It's not a good reason to step away from fitness.
Yeah, just stay moving. We have enough experienced coaches where we can always find something to do. Don't let the looks scare you. The actually physical changing of your stomach getting that big. I know Robin went from more conventional style deadlifts to sumo deadlifts as well, like to give her stomach and hips more room to move. That opens you up a little bit. Maybe she's maybe not the seasoned at that technique as much. She stays a little bit lighter, maintains her strength throughout her pregnancy, also helps that backside stay strong. Where she is overextended, if those muscles are stronger, it's going to help support everything back there. So that's what we're trying to do. We're trying to maintain and make you healthy for that child.
There's somebody I'll mention, a great physical therapist, researcher out of Canada. I'll mention her name again later, but Christina Previtt, she likes to say, pregnancy is hard, pregnancy deconditioned is harder. And it's like, that's exactly true. Again, to the point earlier about relaxin, we're relying much more on our muscles for stabilization and for structure and for support. And so if we just don't have that muscular reserve, we're really going to be hanging on ligaments, hanging on joints, and at risk for a lot more pain and just a lot more, a lot less quality of life, I would say. Like you're just kind of not as able to do your everyday things.
Yeah, it's the same. Like life is hard. Life is harder if you're weak, like in deconditioned. So
yeah, absolutely.
Maintain that.
Yeah. So I guess, like you were saying, what are the things that are the absolute no-goes in fitness? The only contraindications are overheating and heat stroke, which women with that increased blood volume can overheat more easily when they are pregnant.
So be careful in the summer if you're in our gym, seriously, and you're pregnant, no lie.
Yeah. Like I think I took the intensity down some. But again, like I was saying earlier, this is where we're listening to our body. And if we're feeling really nauseous, dizzy, funky, not right, like just as I would recommend for you, like take a step back. We don't need to be going that far just in our everyday training.
Absolutely. As Jose Herrera said back in the day, Catherine, it's a baby, not a crutch. So a lot of the same rules apply for a normal day person or a pregnant person. Like we don't
want you to overheat either.
Yeah,
so
absolutely.
Heat stroke is bad. Listen to your body. Just know that you are at an increased risk for that, being pregnant. And then the only other contraindication is blunt force to the belly.
Yep.
So sports that may have an increased fall risk, I wouldn't play rugby, probably not roller derby. Wouldn't recommend those things.
Wouldn't box jump. Wouldn't do no-handed burpees. It's pretty simple.
Yeah.
Be careful running. Maybe bike or row instead if you feel like you can't do that. But anything like there's an opportunity for you falling or putting you in a precarious situation where you're not going to be able to catch yourself, especially boxes. I'll say boxes is the biggest one. Don't do it.
Yeah, I mean those are really your only parameters, which kind of brings me to heart rate parameters, because I know that you've seen like one of the most common things that you will see in women when they first find out they're pregnant. It's a little bit scary. It's a little bit, I don't know what I need to do, but you'll see women checking their Garmin, their Apple Watch, and trying to stay below 140 beats per minute. So I think it's important that we know where that comes from. And why maybe it's not necessarily the end-all be-all. So interestingly, there is tons of good research showing the absolute benefits of moderate intensity training. There's tons of research within that realm, which is about 50 to 70% of heart rate max. The general recommendation for like just the whole population, I forget if it's like the American Academy of something or another, but the general fitness guidelines are at least 150 minutes of moderate intensity exercise per week. Yeah. And so that recommendation,
if you have a Garmin watch, it comes pre-programmed for that. So
Okay.
So if you open up your Garmin app, it starts you off at 150. intensity minutes per week, and that's your goal to get.
Yeah, so that's like the general recommendation for all Americans. And what they found is that also holds true for women who are pregnant, regardless of their activity status prior to being pregnant. So if you are somebody who was not active before being pregnant, you should start a program of some sort to work up to your 150 plus minutes of moderate intensity exercise per week.
Yeah. And that's interesting because most people probably should have went over this
Conceptions?
Yeah, it's misconception. Yeah.
Miscongeniality.
But one of those misconceptions is, all right, if you hadn't been training, don't do anything. Like that's a big one you hear. Like, oh, you don't need to be exercising. You got to be careful with that, baby. I know we were at church a few weeks ago unloading a truck for the Hurricane Helene relief fund, and Robin was chucking, what was it, bottled waters, cases of bottled waters, and those people were like flabbergasted that she was doing that. Like, you're pregnant, you don't need to be doing that. And I was like, leave her alone. Yeah,
I'm still pregnant, I'm still here. So it actually is recommended by like the mainstream that you take up activity, moderate intensity, if you have not yet. And where that goes awry or can go awry is that then that gets applied to everybody. So you had people who were doing high intensity exercise who now think, well, I need to drop it down to a walking program. And that's just not the case.
No.
And so back to the 140 beats per minute, where that comes from, our poor little dog back here, where that comes from is it's so generalized. It's taking moderate intensity of 50 to 70%, looking at the average pregnancy age of 30 years old, then taking the most basic of formulas that you can use to find a heart rate max, which is 220 minus age. So they take 220 minus 30, 50 to 70% of that is just below 140 beats per minute. So that's where that recommendation comes from. And it's like completely, it's such a rough estimate.
Such a rough estimate and lazy estimate because there's so many factors that come into that, whether, like I said, previously exercising, what's their diet look like, what's their blood markers like, what's their blood pressure, like all that stuff. Like that's completely biased. And I would say that 50 to 70%, if Robin's been doing high intensity training before getting her heart rate to 80, 90%, I would say it's pretty healthy for her to do that as well.
Yeah, so we do actually have some studies, some very high quality recent studies on that. But previously, there was one study. It was 10 women who were set to do a VO2 max treadmill test. And then afterward, they tested the fetal heart rate. And in 2 of the 10 women, they found that the fetal heart rate dropped by a statistically significant amount, just meaning it was not dangerous, but it was, babies' heart rates fluctuate with mom's activity anyway.
Oh, okay.
So they found that in 2 out of the 10 women, it dropped, the fetal heart rate dropped for about 2 or 3 minutes before coming back up to baseline. And so they said, could be dangerous. You shouldn't train at high intensities. These women were going at 100% intensity in a VO2 max treadmill test. There were 10 women. They only found that in 2 of them. This study has never been repeated, and all of the babies were born healthy. So
science.
That was
Hold
the
that
recommendation. So with the newer research that we have actually have much higher quality research. So randomized control trial and a systematic review. So those are the highest level of research, quality research that you can have. Those have looked at women doing high intensity training. So there was the randomized control trial looked at women both doing moderate intensity for 30 minutes, as well as high intensity 10 intervals, 1 minute on, 1 minute off, greater than 90% of heart rate max. And they actually found that the fetal heart rate increased slightly. So opposite of what our other study found. Again, that was temporary. It just kind of corresponded with mom's activity. And they found more efficient umbilical blood flow, as well as no fetal distress. So basically only neutral to positive effects from the high intensity as well as the moderate intensity training groups. So no bad effects from high intensity training or pushing those upper thresholds. And so what we can think about with our training is we know that exercise has anti-inflammatory effects. We know that a lot of the bad things that can happen in pregnancy, hypertension, preeclampsia, gestational diabetes, we know that those things are pro-inflammatory. And so we know that by exercising, we are reducing our risk of those things that we don't want to happen. And so overall, exercising and exercising at a high intensity, doing strength training. The only studies that we have on strength training are using like less than 20 pounds and like the lightest bands that you can find. So there's actually Christina Previtt, I mentioned her earlier. She's doing a couple studies. We can link enrollment to them. But she's looking for people to participate in those. So definitely something worth getting into. But
as far as like inflammatory, like Greg Glassman had a quote. He says, we have the cure for the world's most vexing problem, which is chronic disease. That's diabetes, heart disease, hypertension, hyperinsulinemia, all that stuff that's wrapped into what's killing Americans and what we're spending all our money on in America. And that is exercise and diet. And if it works for us, it will work for our kids as well.
And so, like, once again, we're just seeing the same thing carry over from the general population to the pregnant population. Yep. We shouldn't be scared to do things. Even one more common misconception is that I shouldn't lay on my back. There is a real thing called supine hypotensive syndrome, I think it is, which is basically just the compression of a couple of large veins that pass through the abdomen that can happen if we're laying on our back. But that compression, to the extent that it is doing something bad, will come with symptoms of nausea, lightheadedness, feeling unwell. So again, we're just coming back to, if you're feeling unwell, you're feeling nauseous, you're feeling lightheaded, you're feeling funky, dizzy, any of those normal things that I would normally pull you down from the workout and say, let's modify, same thing holds true for pregnancy. So in that instance, it's like, let's incline you, let's choose a different movement, let's modify accordingly.
Yep. We can modify any movement that bothers you, and that's, I think, the biggest thing. So if we could put a bow on this, what is it, too long didn't read? Long, TLDR.
Yep.
So if you're here, you made it this far, actionable steps is 1, we'll talk about the pillar of nutrition. What should they do?
Start out FIST protocol. So eat whole foods, eat them in moderate amounts, fitness in 100 words.
Eat meats and vegetables, nuts, seeds, some fruits, little starch, no sugar. And honestly, eat more than what you think. Eat more than what you think. That's the big thing we talked about Stacey Sims' podcast. We've had a few girls. I'll throw me in there. I think Galen's eating a little bit more as well. I feel so much better. Like, it's like, I got to get leaner. I got to lean it. Then Tyler Benton said it. Kudos to Tyler. And when you eat for performance, aesthetics come because of that. All right. So don't eat for aesthetics. Eat for performance. And when you perform good, you will look and feel good.
Absolutely. And then increasing throughout the trimesters to meet your metabolic needs. And if you need help with that, reach out. We'd be happy to help. Yep. That's kind of the bow on nutrition, I would say.
And training?
On training, being pregnant can be scary. It can be this whole new thing where you're like, I don't know if this is supposed to feel like this. Listen to your body. If something feels bad, like painful, if something feels like it's making you unwell and dizzy and like you're overheating, listen to those signs, but otherwise know you are safe. Like, you are safe to train at the intensity that you want to train at. You can lift the weights that you want to lift. You can go up toward those heart rate thresholds that you want to go to. Like, you can do high intensity training and it's not going to be dangerous.
But if you're new to it, like as we'd start any new person, you want to kind of start off on that ramp and build up until you can get to that. Don't come in and try to crush yourself on the first day, because that'll just leave you sore and miserable and not coming back. So we want to take it kind of slow. We want to crawl before we can walk before we can run, and then we can sprint.
Always give yourself some grace. So know that with those physiological changes, with that increased blood volume that we talked about, you're going to feel a little bit more out of breath. You're going to get to those higher intensities quicker, and that's okay. Just do what you can.
Community, I would recommend a good community. Don't isolate yourself just from a mental, psychological aspect. Find a good community, whether it's a gym, a church, whatever. Robin's going to start doing some private training as well. So if y'all want to do any private training with her after the baby comes, please do that. Go ahead.
Just an interesting little note on that recent research looking at women who did return to fitness prior to the 6-week rule postpartum. So women who returned to kind of just what they were comfortable with, fitness, actually in a group fitness setting, had improved like mental scores, decreased depressive postpartum scores by doing so. So definitely some, like you said, mental effects, both during pregnancy and postpartum for that.
So do that, guys. Recovery, make sure you're sleeping. I would sounds like we're beating a broken record, but this stuff works. It works. There's no magic pill or shot.
I would say on the sleep side too, general population, if you say, well, I'm doing just fine on 4 to 5 hours of sleep, maybe like take a deep look at what just fine means, because most of the time you're not. If you're in pain, you're having tissues that aren't healing, you're having any sort of issues like that, you're probably not doing just fine and would do much better if you slept.
Yeah, it's kind of like the Stacy Sims talking about adding more calories in. Like, oh, I can't do that. I can't do that. You do not know until you try. Try to sleep a little bit longer. See if you feel better. See if you have more energy during the day. See if your brain's clear. Like, everything's working. You're not getting tripped over your tongue like I do in every class.
Don't need as much coffee. This is decaf.
Exactly. Other than that, guys, have a positive outlook. We're not doctors. Robin's actually a doctor of physical therapy. But consult your doctor. If you feel like they're stuck in the old way of thinking, find a different doctor. Find a better doctor. Like, if they do not work out, they should. And you could probably get some advice from someone who works out and takes care of themselves, and it would be a better example of what the medical field should look like versus just writing prescriptions and telling you not to do stuff that makes you feel a little bit bad. Right, Rosa?
She says, yep.
Robin, anything you'd add?
I don't think so. I think you just kind of summed it up. Something that I found interesting, I continue to always find interesting, is there's this very low threshold for risk when it comes to exercise recommendations. So like we talked about with the moderate intensity exercise, a doctor's not going to recommend high intensity if the research just hasn't been done. Not that there's any research saying it shouldn't be done, just if the research hasn't been done, they won't recommend it. Whereas, yes, there's lots of research on medications, but the research shows like there's always going to be side effects, and yet we're taught to prescribe those. So I just find that it's an interesting sort of paradigm where there's a low threshold for risk when it comes to recommending exercise, but a relatively what I would consider high threshold for risk when it comes to recommending medications.
Yes.
So I don't know, just something I find interesting, and I always tend to lean toward, especially as a doctor who medications are not within my scope of practice. I find the human body to be very resilient, and and very capable. And I think that we should turn to that first.
Yes. Put out the big fires first. Then if you need more help, do it. Like I said, we're not doctors, but we want you all to be strong, healthy pillars in the community, just like you are at the gym. Robin, any mom? We usually ask for dad advice like we did from Steve. You got any mom advice? Rosa, stop.
I guess it's not really a piece of advice, but what I've gotten to gather from women that I've seen in the clinic is just to really cherish every moment that you get with your baby. And I mean, that seems very simple, but like I see a lot of women who have like been through it labor and delivery wise, and still it's like the baby is the biggest blessing. Like absolutely there's nothing that compares to that, nothing that beats that. And I feel very grateful and very excited that we get to experience that here shortly.
I'm excited. Hopefully in the next video you see with us will be a little fellow with us talking about postpartum training and nutrition and all that stuff. So Robin, thank you for showing up and being on the podcast, the Outlier podcast. And anything you want to add?
Just if you're interested in training, don't know where to start, where to go, are kind of a little bit apprehensive of how do I get core bracing? How do I know that I'm staying within these safe parameters? Feel free to reach out. Again, I'll be taking some personal training clients here shortly. And we always have the group fitness as well at the gym if you're feeling a little more comfortable and want to jump into it.
All right, guys. Thank you all.